Well, good morning, and welcome to the 14th International Patient Symposium on MPNs. It's organized and presented by CR&T, more formally known as the Cancer Research and Treatment Fund. And some of you may be a little unfamiliar with the organization, so I'm going to share a very brief history with you before I make a special announcement about somebody that many of you know. Dr. Richard Silver founded CR&T 57 years ago, believe it or not, with the idea that doing blood cancer research not only would lead to important breakthroughs, but might also give us some insights into the biology and treatment of other cancers as well. And since then, CR&T has gone on to raise funds and donate $17 million to cancer research, and that includes $8 million to create and the Silver MPN Center at Weill Cornell Medicine, as well as to support its research over the years. Now, since CR&T's inception in 1968, Dick has served as its chief medical officer and vice president, and was the driving force behind the creation and operation of this symposium. So first of all, we congratulate Dick on a long and incredible career, and also on making the move from active status to emeritus status with respect to his roles at CR&T. So in his honor, we're pleased to announce today that the symposium is now named the Richard T. Silver International Patient Symposium on MPNs. And I'd like to give a little round of applause to Dick. Wait, hang on just a second. He won't be with us here today because at 97, he's decided to retire from public life. But I'm sure he will feel the warmth of your applause in his heart. So let's give him. And I'm now very pleased to introduce you to CR&T's new Chief Medical Officer and Vice President, Dr. Ghaith Abu-Zeinah, who's also my friend, my physician, a noted researcher, so he's checked all the boxes. Ghaith?
Thank you, Dave, and good morning, everybody. I hope you all had your morning coffee. It's going to be a long day. I certainly had mine. I spent 12 years of medical school and training not needing coffee until I had kids. And I will say that my two boys kept me and my wife up all night, so that coffee gave me a kick of energy to get the day started. But what I think is even more refreshing than coffee is looking at all the familiar faces here and the new faces joining us. So thank you all for coming. It's really wonderful to have you all. I hope you enjoy the event. For those of you who don't know me, my name is Ghaith Abu-Zeinah. You can call me Ghaith. You can call me Dr. Abu-Zeinah or Dr. AZ for short. I am a hematologist and oncologist. My specialty focuses in MPNs, both clinical and research. We have a research program as well at the Richard T. Silver MPN Center. It is my privilege to be the chairman of today's Richard T. Silver International MPN Symposium. It is also truly an honor to be named the CMO and VP of Cancer Research and Treatment. And for that, I'd like to, of course, thank Dr. Silver, thank Dave Boule, whom you've all met, and also the president of CR&T, Tom Silver, who's with us here in the audience. So thank you, Tom. Thank you, everybody. With that being said, although this is called the 14th International Symposium, this has been going on for 24 years. What used to be an every other year event is now an annual event, so we're happy to be able to do this every year now, and we get a lot of positive feedback about how educational this event is to patients and family members and caregivers. So with that being said, today we're joined by more than 100 patients and friends from 26 states and 6 countries. We extend a warm welcome to you all. Again, some of you have been here before and know what this is all about, and many of you are coming for the first time, but we've always been very impressed by your thirst for knowledge, your excellent questions, so I'm personally looking forward to hearing all the questions you have throughout the day and in the Q&A sessions, which we will be addressing your questions then. Before we begin our program for today, we are pleased to hear from Dr. Jed Wolchok, who is the Meyer Director of the Sandra and Edward Meyer Cancer Center here at Weill Cornell Medicine and Professor of Medicine. Dr. Wolchok's bio cannot be mentioned in only a few minutes that I have because of all these accomplishments, but I will summarize. Dr. Wolchok, by way of background, is a physician-scientist exploring innovative immunotherapeutic strategies in laboratory models. He's a principal investigator in numerous pivotal clinical trials. He helped establish immunotherapy as a standard approach to cancer treatment. He was instrumental in the clinical development leading to the approval of the drug ipilimumab and the combination of nivolumab and ipilimumab for advanced melanoma. He supervised an NIH R01-funded basic science laboratory focused on investigating novel immunotherapy agents in preclinical laboratory models. Dr. Wolchok received his bachelor's degree from Princeton University, his master's degree, his PhD, and his MD degrees from New York University. And he has received numerous awards and honors for his work, including the NYU Grossman School of Medicine's Giants of Cancer Care in Melanoma Award, the Burson Alumni Achievement Award in Clinical Translational Science, and the Zilmanovich Young Alumni Achievement Award, all from NYU, the Memorial Sloan Kettering Distinguished Alumni Award, the ESMO Award for Immuno-Oncology, the ASCO David Karnofsky Award, and the American Association for Cancer Research Richard and Hinda Rosenthal Memorial Award, and the Joseph Birkenau Award for Outstanding Achievement in Clinical Cancer Research, and many, many more. We are truly honored that he is the leader of our Cancer Center, for a few years now, and the Cancer Center is exactly where we want it to be, and we look forward, under his leadership, to getting the Cancer Center to where we want it to be in the near future and long term. He also holds several other leadership positions, which really I have listed here. But for the sake of time, Dr. Wolchok, I'm going to ask you to come to the podium and say a few words. Thank you very much for coming.
Thank you. I'm going to take the opportunity to call you Dr. AZ from now on. I welcome everyone on behalf of the Sandra and Edward Meyer Cancer Center. It's a real privilege to have you here with us today. I think that this is really one of the highlights of what we contribute to the ecosystem on this street corner, is providing an opportunity for patients and their families to hear about progress in the diseases that they are living with. And I think that we are very, very fortunate to have such a long and distinguished history in the area of research and treatment for myeloproliferative neoplasms. And I can't say enough about Dr. Dick Silver and his legacy. It's really wonderful to see the naming of this symposium for him, because it really represents lifelong devotion to understanding these diseases better. As was mentioned before, there's a lot that we I'm a simple melanoma doctor. What we can learn from the research in the area of MPNs, and what the researchers in the area of MPN biology can learn from us who study solid tumors and the treatment thereof. One area of overlap is actually the use of the immune response to cancer, and actually some of the work that our laboratory has done has focused on the possibility of developing vaccines for myeloproliferative neoplasms based upon knowledge that we have gained studying other cancer types. So I think that opportunities like this are really what is needed for us to make progress across different diseases. I think that the sharing of knowledge with people and their families is incredibly important. And I also have to acknowledge the enormous generosity of CR&T. In the current times that we're living, with federal funding being more scarce than it was in the past, we recognize the deep importance of generous philanthropic support for the work that we try to do. And certainly CR&T has set a very high standard for that. So from all aspects, on behalf of the Meyer Cancer Center, we're happy to have you here with us today. We are grateful for the participation of the Silver MPN faculty in our day-to-day operations, as well as for the support from CR&T. I hope that you have a very enjoyable day. I regret the fact that I have a waiting room full of patients at 1305 York Avenue, so I will not be able to partake in the knowledge sharing, but I look forward to hearing about it afterwards. So again, thank you very much and have an enjoyable day.
Thank you, Dr. Wolchok. And with that, we can kick off the day. Thank you for setting the tone for this event. There's a lot of overlap in cancer therapy, and I think what we've learned from the experience in melanoma and immunotherapy could in some ways be applicable to MPNs. So with that, I would now like to acknowledge the sponsors of our symposium. As you can see, we are fortunate that the list of supporters has grown recently in the past few years, and it continues to grow. As you can imagine, this is in direct correlation with the companies that have drugs for MPNs or are developing drugs for MPNs. So this is actually quite exciting to see how much more industry support we are seeing and we are getting for this event, but also for drug development to treat MPNs. We have some of these representatives here. There are booths outside. If you'd seen them, certainly stop by. You can learn about what each of these companies are working on, and I'm sure they're happy to share some knowledge with you as well. I would like to also give just special recognition to our diamond level sponsor, Insight. Insight has been a longtime supporter of CR&T's mission and educational initiatives, especially this symposium, so we are very grateful for them and for everybody else who's supported this event. We are additionally very grateful to the individual and foundation supporters listed here for their current support and also previous support for this event. They recognize clearly how important this educational event is. All these generous gifts from our donors really help underwrite this event and really make the registration accessible to all patients. Again, we're very fortunate to have all this support. Let me also express my gratitude to all the speakers who have taken the time to be here with us. This is a list of highly accomplished speakers with bios, very long bios, which I will not be able to cover today, but they're very accomplished, and they're coming from across the United States and internationally as well to be here with us today. So we're very thankful for their time and the knowledge that they will be sharing with us today. This is a snapshot of the program, which you all have in your brochures, in your files. So take a look at the program. The plenary sessions, so all the way up till the lunch break and afterwards, these are plenary sessions which I think you'll all benefit from attending. As you listen in to the talks, please think about any questions you might have, write them down, and then pass on your written questions to any of the CR&T staff that you've met, Chad, Mike, Mara, or really any of the boxes that you see outside. Whenever you write a question, please pass it on to them or in the boxes. And we'll try to answer as many of those questions during the Q&A. I also want to draw your attention to a special session this year. So it's a lunch session, Women and MPNs, given by Dr. Hobbs. For those interested in attending, you could grab your lunch and head downstairs to the second floor where that session will be held. This room will also be live streaming the session, sort of an overflow room. So if the room is full, feel free to come here. But there should be tables downstairs on the second floor so you can enjoy your lunch and listen to the talk. In the afternoon, after our main Q&A, we have a special session. We're going to hear from the MPN Research Foundation. I'll introduce them later, but also excited to have them speak to us today about their initiatives, particularly the MPN registry. And then at the end of the day, we'll have the breakout sessions. So you can see that there's the room numbers should be in the folder, but we will break out into PV, ET, and myelofibrosis sessions where you will hear a short talk from one of our panelists, and then the panelists will be there in sort of a more personal, smaller space where you can directly ask questions and get the answers and really have an interactive discussion with them. Okay. And with that being said, we covered the agenda. I just want to just highlight again. Here's the CR&T's mission statement. CR&T for 50 years now has been supporting cancer research, really all forms of cancer. When it was initially founded by Dr. Silver, and has really taken a big focus on MPNs and supported the MPN program here at Weill Cornell and supported the symposium for the many years before. So again, I'd like to thank CR&T, and particularly I want to thank the CR&T Patient Committee, which convenes to actually discuss this event and talk about what topics patients are most interested in. So it's really an event designed by patients for patients, and we're grateful for their time and the effort they put in helping us set this event up and pick our speakers and talks. All right, so it looks like we are a few minutes over, so I'm gonna, again, just maybe conclude here. I wanted to introduce some of the CR&T staff. I know many of you have met them, but I will maybe skip over that for now and get started by introducing our first speaker. So with that, it is